few weeks back, a thunderous explosion destroyed a hospital for COVID patients in the Ural Mountain city of Chelyabinsk. Oxygen tanks blew up. Remarkably, no one was killed, but it was yet another embarrassment for Russia's cash-starved hospital system. The health ministry says 90% of beds in the country are now full. We've reported on patients being treated in stairwells, in bodies overwhelming morgues, so we asked to get inside a hospital to see the conditions for ourselves. This is where we were brought. It's a convention center in northern Moscow, the size of an airport hangar, transformed into an enormous COVID ward. No sign of a collapsing system here. It's just on the other side of the door, the so-called red zone, and we're going to have to get sealed up tight. Many hospital workers have complained about the lack of personal protective equipment, but these shelves were stocked, and there were plenty of people to ensure not a germ got inside of our suits. It's pretty hot, but you really are sealed up. There's no question about that. Beyond what resembles a space station airlock was the COVID ward. The day we visited, there were 700 patients here, but there was room for more. Anybody who is not wearing one of these is a patient.
It's a patient, yes.
They're all patients.
Yes.
Our guide is Dr. Ekaterina Popova, a neurologist by training who has quickly pivoted to looking after COVID patients. And all of these people, how sick are they? Very sick? Little bit sick?
No, very sick.
Very sick?
Yes.
Have trouble breathing?
Yes, they have some problems with breathe.
Uh-huh.
Yes, some problem with temperature, high temperature.
High fever?
Yes.
Many needed oxygen, but more than that, they seemed to be in a state of shock that they were even here. This is Ramil from Moscow.
Но не ожидал такого. Думал, такого не будет. Верил, но думал, может, как-то легче все это проходит. Но у меня что-то очень тяжело.
For another patient, Mikhail, it was physically exhausting even to say a few words to us. He believes he got COVID on the city's metro.
Думаю, как грипп. Казалось тяжелее.
Walking through this ward, a couple of things stand out. Yes, most people here are older, but what's surprising is, in fact, the number of people who are younger, under 40, under 30, even some in their 20s. What's also clear is that this is a modern facility and not at all typical of the terrible scenes that we've seen in hospitals elsewhere in Russia. Everything here is high-tech. For example, all the information about a patient is stored in QR codes and staff have it at their fingertips. Need a lung scan? Not a problem. Didn't seem to be much of a wait. And upstairs, doctors were demoing a new IT system to better share information about patients. The doctor overseeing it all sounded pretty proud.
Койками город обеспечен, у нас есть места для госпитализации пациентов, у нас полностью есть обеспечение и компьютерной диагностикой, и препаратами лекарственными, и всеми обследованиями, которые положено делать. Медики устают, скажем так, но они работают, и никто не жалуется, все спасают жизнь людей для того, чтобы побыстрее пандемия наша закончилась здесь у нас в России.
I think that it's typical only for Moscow, maybe for St. Petersburg, maybe for Yekaterinburg, but other regions are very poor.
To give our tour some context, we reached out to Dr. Anastasia Vasileva, who's with the healthcare union opposed to the Putin government.
Higher quality, FFP3, high quality.
She's just back from delivering supplies to rural hospitals north of Moscow.
They didn't see such good costumes, such good respirators, and gloves. Yesterday we gave them gloves.
She says some hospitals looked more like prisons, and many staff were simply overwhelmed by the COVID workload. Her visits are not popular with the government. Along the way, she says police repeatedly stopped and harassed her.
I think that they are trying to show that in Russia everything is good, and Russia has no problems with the coronavirus, with the medical staff. I think that's maybe chief doctors and some officials, they put money in their pockets, I think so, because I don't know why our rich country has such awful and terrible hospitals and clinics.
In Russia, the pandemic has accentuated the vast disparities in the quality of healthcare depending where you live. Moscow gets big new facilities like this, while most other places just try to scrape by.
And Chris Brown is with us now. So Chris, can you walk us through the access process in Russia? Because that was fascinating.
Well, often the Russian government will let journalists, even Western journalists, into places where you might not think they would if they believe there's a good story. And here they at least believe the narrative could come out that, look, they're fighting the good fight against COVID. Have a look at our great new hospital. Look here, as it were. Don't look over there.
So clearly two very different healthcare systems outside Moscow. How bad is it in hospitals there?
Well, it really is the whole story of Russia in a nutshell. You have the center of economic, political power in places like Moscow and St. Petersburg, and everywhere else kind of gets the leftovers. And so the pandemic really has, accentuated that divide, and it's coming out in healthcare. We've done lots of stories. We're hearing stories almost every day of doctors in rural areas complaining about the lack of medicine, complaining about being overworked. We've heard of, and seen pictures of morgues full of bodies, 30, 40 of them in hospital corridors, simply because there aren't enough doctors, in places to do these autopsies. Adrienne.
All right, Chris, thanks to you and the team for this. Chris Brown in Moscow tonight.